Chairman, just would like to associate myself with the comments of the MP for the East Coast on this financial review of the Bay of Plenty District Health Board. Health boards in New Zealand can pretty much be divided in three groups. One is a group that has fast-growing populations, a third have very stable populations, and a third have depopulation. And each of those groups presents significant challenges. The most significant challenge, strategic issue that the Bay of Plenty District Health Board has faced is actually keeping up with a rapidly growing population and also a growing older population. And that's why the District Health Board, together with the almost $130 million of extra funding that our government has given, has been able to invest in significant numbers of extra doctors, significant numbers of extra nurses, and I think a 52% increase in hips, knees and other orthopaedic procedures there to reflect the ageing population. But at the same time, they've not only dealt with that fast-growing population in the West, and there's been significant investments in the new East Wing at the Tauranga Public Hospital, the purchase of the RSA land, which is now the clinical school. There's been big investments there at the West. There's also been a need to invest in the East, which is a predominantly lower income community. It's a much higher Maori population than the West, so there's a whole lot of issues that have happened there. So our government's not only been investing very strongly in primary care. You can't have a strong primary care developments in isolation of good hospital services, and that's the reason why, with this very strong advocacy of the MP for East Coast, Mrs Anne Tolley, the government's put $67 million into a new state-of-the-art hospital in Whakatane. It's a tremendous investment, and I had the opportunity to tour the facilities there on Friday, and it's fantastic how well that facility integrates with the primary care services in that community. Very important for the Bay of Plenty. But what makes it more exciting is that the people at the Bay of Plenty District Health Board are recognising that healthcare changes, and Mrs Tolley talked about the people who live way up the top of the Cape. Transport issues are very significant in the Bay of Plenty because of the isolations of the people up to Whanau Apanui, but also the people of Ngāti Manawa in the Murupara area. So, and also issues around Kawerau, we've got low-income people. So Bay of Plenty District Health Board is actually at the forefront of telehealth in New Zealand. A significant investment has gone into providing telehealth. So by way of example, in Oporiki, up the coast, and in Kawerau and Murupara, patients can go into their GP clinic and have a online, higher quality than Skype, but a Skype-type conversation with a specialist either at the Whakatane Public Hospital or at the Tauranga Public Hospital. You can see the significant benefits that has. Similarly, in Oporiki now, the rest homes are linked in too. So there was a patient and a resident in a rest home who had a turn. They were able to use the telehealth Skype-based technology for the GP to be in his home and consulting with the rest home resident in her home over the telecommunication networks, and similarly with patients up the coast. So not only are we investing very strongly in the bricks and mortar, but also in the new technology that allows people to have much faster and more convenient access to all this expertise around the health service as well. Similarly, the Bay of Plenty District Health Board is entered into a public-private partnership with the development of private radiotherapy services that will be available there from end of September. This is a very significant investment. What it means is that cancer patients in the Bay of Plenty who would previously have had to travel to Hamilton for their radiotherapy will be able to receive that treatment at private facilities integrated into the Tauranga Public Hospital. And that's the really next big step in services for people of the Bay of Plenty, is this really significant investment that's been made by private investors who will be able to treat not only private patients but also the public patients, and the opportunity over time to have neighbouring District Health Board patients treated there as well. And very, very good public hospital cancer services there in the oncology area, but this radiation will provide just that extra suite of services to benefit patients. It's a pretty smart public-private partnership that enjoys the support of the wider population in that area. So just to acknowledge the tremendous work of the people of the Bay of Plenty District Health Board, who in my 24 years as a Member of Parliament, I can just say that I think the service being provided is sterling. There's a real dedication and commitment there, and I think we can be very proud of the clinicians there.
The question is that the report of the Health Committee on the 2012-13 financial review of the Bay of Plenty District Health Board be noted. Those of that opinion will say aye. To the contrary, no. The ayes have it. I understand the next entity members wish to debate